Test, test, 1, 2, 3. Test, test, 1, 2, 3. Test, test, 3, 2, 1.
stream it.
All right. So fantastic. That's been 5 seconds, and I can speak now.
Okay.
So happy to be speaking.
If I may, I'd like to start the meeting of the Board of Managers on 1300 or 1 p.m. Thursday, November 12th, 2020. I have this little script that I have to read. That we are able to meet by means of electronic participation thanks to emergency orders of Governor Greg Abbott and Attorney General Ken Paxton, dated the 16th day of March 2020, which has temporarily suspended certain requirements and provisions of the Texas Open Meetings Act. Though we are not all able to physically meet at the boardroom, most board members are participating today by video conference using the WebEx web conferencing application. I'm asking all of us, board members, JPS staff, and general counsel, to be patient and do our best to make this meeting as smooth and effective as can be. And then I have to, A, make sure there is a quorum, and B, call the roll.
You have 8 board members present. I don't know who that call-in user number 2 is, though.
Pardon me?
I show 8 board members present.
Okay.
Call-in user number 2 is Roger Fisher.
Oh, okay, thanks.
Who's missing? DT missing?
Nope,
Nope.
you got Dr. Simmons and Charlie.
I'm here.
Oh, okay.
Just joined.
I'm here.
Okay. There we go.
Steve just joined. Charlie on?
No.
So we have 10.
10 board members. Yes, sir, Mr. Chair.
All righty. If we could now have the opening prayer and the Pledge of Allegiance. Is Leanne there?
Yes, good afternoon, everybody.
Hi,
It's so
Leanne.
good to hear the laughter. So after laughter, another great way to begin is with prayer. So will you all please pray with me? As we gather together this afternoon, we are well aware of the challenges before us. And more importantly, we are aware that we are built for challenge. JPS has never shied away from doing the good thing, the hard thing, the right thing for our patients, for our teams, and for our community. And so we ask, grant us wisdom, grant us courage, grant us unity of mind, heart, and spirit. Fill our hearts with gratitude for the heroes in our midst, for the veterans who are serving among us, for the leaders who guide us, for the board members who inspire and equip us. We are all in this together. Together may we do great things. In your holy name we pray. Amen.
Amen. If you would, people stand for the Pledge of Allegiance. I pledge allegiance to the flag. Can anybody hear me?
Yes, we got you.
What happened?
We're good.
I pledge allegiance,
Pledge allegiance to the flag
To the flag
of the
of the
United States of America,
and to the republic
For which
for which
which
it
is
stands,
that stands
one nation,
one nation
under God,
under God, indivisible,
with liberty
with
and
liberty
justice
and
for all.
justice for all.
What the heck happened there? Mendenhall's involved in some way. Next item's number 4, the approval of the minutes, Board of Managers, October 8th, 2020. Entertain a motion and approve.
This is Dorothy. Move approval of the October 8th minutes.
Is there a second?
Amanda.
Who is that? Steve Simmons? Who was that? Okay, now I see Ralph. You've had a motion and a second. Is there any discussion about the minutes? All in favor, please say aye.
Aye.
They opposed, say no. Okay, that passes. Under my board chair report, just a couple things. The board officers met with Daphne, our new in-house legal counsel. We discussed a lot of issues, especially developing the Department of Legal Services. And of the many things we discussed, one of the things is we will be as officers, we will meet with Daphne at least on a quarterly basis. I don't know if those meetings will be in person or virtual, but that's the plan. The second thing that I have has to do with a claim, and Dorothy, chime in on this anytime if you want to. There was a request for proposal passed to have some folks come in and evaluate a claim, its structure, its organization, and of particular interest apparently is a physician compensation model. And that was a bunch of them. RFPs were whittled down to 2. This week we listened to the 2 semifinalists, and then we'll be making a decision here pretty closely. The second part of a claim is we had a very good update on the Arcadia system, which is in with a claim which allows them to do all sorts of analytical stuff, some of which I do not understand, but I do understand that it's needed as a successful group to have a claim really moving on, keep going on the way they are. I think Michael Hoxberg deserves a lot of credit for what's been developed at a claim, and it's going to be interesting to see what the final search group says. Dorothy, you want to add anything to that?
I think you covered it very well with the claim, the RFP. I think it will help us understand and be able to explain the organization and how the both systems work. I'm looking forward to it. Okay.
I agree. I think one of the key things for me, and I hope that everybody gets the message, a claim is not just an appendage that's attached to JPS. I mean, a claim is our providers for the medical services, and they need to be an integral part of everything that we do. So that's just my 2 cents on that one. So, and that's all I have, except once again to say thank you.
Mr. Chairman?
Thank you. Yes, sir.
I'm a little lost. The RFQ, is that what we did, or RFP, whichever one? You're coming in broken up. RFP. I'm not quite understanding. What is the RFP to do? What is the firm to do that we're looking for?
Dorothy, you want to tackle that one?
All right. Remember, we were looking at a firm to come in and do an evaluation of the claim, look at the structure, our cost structure, how we are established, help us look at our cost to be able to have some meaning and justification for how we are structured and how well it is working. It is just remember when we did the budget, we talked about someone coming in and helping, and I think it will be a good education. So it will show how a claim, the system, how we all work together, and how all those costs are allocated. Okay.
Okay. Okay.
You okay with that, Ralph?
Yeah, I'm good.
Okay.
All right. Once again, I just want to say thank you to all the people that are providing care. It's a scary time. This virus is apparently not going away quickly. So once again, thank you. Thank you, and the Board of Managers, thank you. And that's all I have. Robert, you're up. I can't hear Robert.
I know it's the day after Veterans Day, but I did want to call special attention to the service that you as veterans provided this country and me I did not serve in the military, and the reason partly that I did not serve in the military is because I had people like you that protected my freedom. So to you, Ralph, and to you, Chuck, and to you, Steve Simmons, and the other veterans that we have, I so appreciate you. And to DT Wynn for all you're doing to the veterans in the Vietnam War and to the people of Vietnam. We all here are grateful. And that's that same kind of community spirit that you have on this board, you gave to this country. And many of you gave it at a most difficult time. And Steve Simmons in a challenging time when we had not been in conflict for quite a while, Chuck Weber in a MASH unit in Vietnam, Ralph Emerson dealing with huge racial prejudice as to who should and should not go to war. He defied his community and went to war and fought for my freedom. So I am grateful. And DT Wynn, what you're doing in Vietnam to repair past challenges is admirable. And so I just, basically stand on the shoulders of giants who made things very nice in my life due to your sacrifices. So from a Veterans Day, we did our best here at JPS of recognizing our veterans and thanking them for their work and service. It's not our usual type approach, but we did our best because we shall never forget those that stood proud for our freedom. Also, in a day of remembrance is a 10-year anniversary of our trauma unit. Many of you on the board were instrumental in bringing trauma care to this community and a level 1 trauma center. How time flies when you're having fun. And to have 10 years of a level 1 trauma center is really powerful. I think every year, and it is evidenced in every 3-year survey that we have, our trauma team has improved. What we're doing from a research standpoint, what we're doing in community outreach, and what we're doing to save the lives of many people who are in their most vulnerable positions in a trauma is not only admirable, but it's amazing. And I can't take my hat off more to a trauma team, and particularly as being one of those trauma patients. I am so thankful that I get to work for a place, and I also get to serve, my health gets to serve by a place that is a level 1 trauma center. And we are more than adequately taking care of this community with one trauma center in town, and we do a really good job of it. And the state has recognized that we are what this community needs, and the American College of Surgeons. So to you, Chuck Weber, who were an instrumental part of that in your role as a surgeon, and many that have come after you, we are hugely grateful on their 10-year anniversary. We are moving ahead. I mentioned to you all the partnership we have created with Cook Children's in our school-based clinics, and we are very happy that Cook Children's has embraced us as a very viable partner in our school-based clinics. I reached out and spoke to every school superintendent in Tarrant County and told them about a potential new partnership with Cook and how we would be providing additional services in our school-based clinics, particularly in the area of telemedicine, and what we would do to help students stay healthy and for our school districts keep kids in school, because we think that a telemedicine program can expedite a lot of things and certainly make a big difference for our schools and keeping up that population in the schools that we need, particularly in light of COVID, when you have to be very sensitive about how many people are going to be in a waiting room, particularly when that waiting room is a portable building at some of our schools. So our schools have been great partners for us, and now we look forward to an additional partnership with Cook Children's. The other thing, and I know that you as board members have not necessarily been involved with it in the past, but you've always been hugely supportive of us. Thanksgiving at JPS has always been a special time because it does allow you a moment to reflect upon the gifts that are given to us, and the gift of health, the gift of employment, the gift of the camaraderie of fellow workers and the team that we have at JPS. We have struggled this year because every Thanksgiving, we give every employee, including our contracted EVS team, a turkey, a ham, or a fruit basket. And they are in that order. Turkeys are very popular. Hams come in a close second place. And unfortunately, fruit baskets are trailing in third with about 14 people that really like fruit baskets. But we are there for those 14 employees that want their fruit basket. And every year, if people will make eye contact with me, we line up in a line. And if they make eye contact with me, I give them a turkey and a hug. That hug drives Suzanne crazy because she doesn't think that hugging 7,000 people is a really good idea. But it brings me joy, and we do that. This year with COVID, it's been a real challenge. The other challenge that we had is we had a lot of meat packaging centers throughout the United States, particularly the largest one in Minnesota closing down. So getting hams this time of year has been a real challenge. But our team, particularly Alex Dubaclay and Chris Lyons, and some of the stellar folks that we have with Diana Brodeur and Laura Burnside and Karen Duncan, who's a huge supporter of the turkey toss, we were able to figure out a way to make the turkey toss happen this year. So what we're going to do is we've taken the parking area behind our foundation office and the Women's Center, and we've cleared out those parking lots. We've gotten a plan together with the Fort Worth Police Department and our police department so we don't clog traffic. People are signing up for times, and they're going to drive their cars through a windy little trail, and we will put the turkey and or ham and or fruit basket in their trunk or back seat. We will wave at them. Robert Early has been instructed he is not allowed to hug anyone. He is not allowed to get that close to the car. And we will not lose a tradition here at JPS. And I realize that we are conscientious of COVID. We want to protect our employees, but at the same time, we still want to be human. And we want to make sure that we help out people in a time of getting a turkey when they might need it. And so many of our employees will gift back that turkey to area churches and area missions. So we're proud of continuing that tradition. So next week, we will begin the turkey toss tradition. So we will be out there handing everybody their turkey, ham, or fruit basket. Unfortunately, and I see it on Dorothy's face right now, because we talked about pies a couple of weeks ago, and Dorothy said, I didn't get my pie. And I understand. So turkeys at this time only apply to employees. I'm sorry, board members, but we'll look at changing that policy possibly in the future. But we've got it down, and I'm proud of that, because I think that's a way that we can still create some level of normalcy in a world, as Chuck Weber said, that's not normal anymore. So we're trying our best, and we're going to continue that proud tradition. The last thing,
Robert,
yes, Pastor.
Robert,
yes, sir.
Since we get paid 2 cookies a meeting,
yes, sir.
Are we considered employees also?
No, but what we are going to do is we're trying to work really hard with our team to get you a turkey-shaped cookie. And that's what we're working on right now. We're having a little bit of challenge on the feather portion of it, but that's what our nutritional team is working on.
Good.
I want to see Karen Duncan throw a turkey-shaped cookie at Reverend Emerson.
Yeah, well, she's getting really good at tossing turkeys, and like I said, it is a high point of the year.
Chuck, we need to have a separate conversation.
Okay.
This turkey toss.
So now, come rain, come shine, come snow, or 80 degrees, no matter what we get in Texas, we're going to do it. So we'll go from there.
Tell Ralph these cookies are good, though, Robert.
Good. Thank you very much, Charlie. You joined the meeting just in time.
Look at that.
The last thing that I will tell you all is that Suzanne is going to be sending you all out a bit of a memo. What we have done, and I don't think it will interrupt anybody's life in particular, but we've changed the schedule for next year a bit. We're switching the times of the quality committee meeting and the planning committee meeting. We have just reversed those. Planning will now be at 1 o'clock and quality will be at 3 o'clock. Both the chairmen of those committees have agreed to that, which we appreciate. We did have some scheduling challenges. As you all know, Mr. Petty has a rather large family of boys, and they are demanding boys, and they needed to be scheduled from school in the proper time, and that is a key responsibility of Chairman Petty. So we did not want those 3 boys, who I understand are like 6'9" and just tough boys. We didn't want them mad at us. So we made that so that we can accommodate family schedules, which is really the most important thing in life. So we're just going to reverse those.
Robert?
Yes, sir.
Appreciate that, and I appreciate Chuck being willing to move quality to accommodate that. They're not 6'9", they're 6'5", but they're 14. So we still got time to grow.
Exactly.
I want to tell you that we will today. We are starting what will be our 28th day of quarantining for one of the 3 boys. In the infinite wisdom of the COVID world, somehow you can send home one of a family and expect things to be okay, and the other 2 can keep going to school. So it's made the taxi service job of Mr. Petty even more challenging, and I appreciate particularly Weber, but the rest of the board's patience as we work through this insanity.
Yeah, I love the fact that you describe the boys as they're only 6'5", and then you add the comment, but they're 14. So yeah, it's that we look forward to watching those boys grow. I think at some point we'll see them on TV being some type of an athletic star. So
it sounds to me like that Trent needs to buy one of them a car.
Yeah. Well,
I was thinking about maybe all 3 of them.
They're going to be pulling my cars. What they're doing.
It's certainly great, Trent, to have friends on the board that want to help you and your family buy cars for everybody in the family.
Papers ready for you, Trent.
So, Mr. Chair, that is all I have for today. And then when you get to the part on item number 8, I will introduce the department that's going to come before you all, and I'll say a few words about them, but I'll do that at the appropriate time when that comes up, and that'll be after Dr. Hurd's comments.
Hey, Robert, can I ask one question? I don't see it on the agenda, and maybe it's going to come up, but in light of all the newspaper articles on the surge, can you give us just a thumbnail sketch of where JPS stands right now in terms of ICU beds, capacity, et cetera?
Yeah, no, I appreciate that, Trent, and I will do that. In fact, we just had our weekly meeting with the area CEOs, and I can tell you that THR and Medical City and Baylor and Cook are all in about the same place. Our numbers continue to escalate. We have communicated to the judge that we are now in a situation where we think that policies should be looked at about the movement of people and how many people can congregate and what we're doing. I know the judge made some comments at the court on Tuesday about athletic events, those types. And when it comes to athletic events, the judge has quickly found out that everybody has an opinion on an athletic event. But it is very challenging times. And I think what we, as CEOs and as leaders of healthcare, we want to take note of the challenges that El Paso are going through. And I think El Paso probably wishes that 3 or 4 weeks before they hit the huge surge, somebody was ringing a bell. So we as CEOs are beginning to ring that bell. It's not a bell of complete alarm, but it is a bell to indicate that for the past 5 weeks, we have seen our numbers escalate pretty much on a weekly basis. So we are seeing that now. We do not have capacity issues. We do not have necessarily employee issues, but we're getting to that point where COVID is creating fatigue amongst our staff. It is hard to constantly ask our nurses team and our doctors team and everything to keep plowing through every day those numbers as they increase. It's causing us board members to look at our elective surgery program again. It's causing us to look at our visitation programs. And the other thing that we did discuss with the CEOs is, will we be able to get together as a group and discuss any policies that all of us would have regarding vaccinations? And we are going to try to do that as CEOs, that we would have some commonality so that we can all approach when and if a vaccine is available, how we best approach that. So our numbers continue to increase. They're getting, our highest point was about 128 hospitalized patients. That was at the last surge that we saw after the Memorial Day vacation. Now, today, we're up in the lower 70s, and it's been a challenge. The one plus is that we have not seen huge volumes of flu, and that would certainly complicate our life. JPS had its most difficult day on Monday, when we usually have those kind of days 3 or 4 times a year, where we just have an inordinate amount coming in for the emergency room visits. So we called an internal code yellow, which is basically all hands on deck internally. It's not an external code. I know that there were a few facilities at THR that called similar situations. Just happened to be that weekend, that time. So we're persevering. We are not in trouble from a PPE standpoint. We are not in trouble necessarily. I couldn't say, oh, staffing is a major concern, but it's a problem. It is a challenge. More people are calling in saying, I'm sorry, I can't be at work. We currently have now a little over 500 of our employees who have contracted COVID since March. And again, put that in perspective, that's 500 plus employees out of 7,200. But it does call into question board members' visitation. And what some of my colleagues are seeing is, particularly in surgeries, where you come in as a coming in for surgery, you will be tested. You are negative at that time. You are recovering in the hospital, your family comes to visit you, and before you're released, you are a positive COVID patient. And so what hospitals are seeing, at least my colleagues in Tarrant County are seeing, is visitation is causing COVID to come in the hospital. Not that you're contracting COVID in the hospital, but it's coming from the outside. And we, like many others, don't have a true sophisticated tracing of COVID, but many times we see that COVID is being contracted from the outside, not from the inside. So I hope that wasn't too long-winded, Trent, but that is an update, and I appreciate you reminding me to give you all that update. I continue to give our elected officials their weekly updates on where we are, and Diana Brodeur continues to give the press and anybody else who wants it to call in to our number every day and find out our numbers every day. And we've been applauded for that transparency, and I'm proud of Diana and the communications team for doing that.
Robert, has any discussion, I know it's early, but any discussion taking place with the heads of the hospitals in reference to the protocol process for the vaccine?
We had that discussion last night, and what we are waiting for is the CDC guidelines that will help dictate a lot of that. There was an article in D Magazine in their healthcare division that interviewed lawyers and said that it is not outside the realm for industries, particularly healthcare, to mandate vaccinations. It is not against any legal statute to mandate those, as we mandate flu shots. But I think we want to look at the science behind it, because it can't be compared to flu necessarily, because we've had so many years of the flu vaccine. We've got a great deal of science and a great deal of outcomes behind it. We won't have that with this vaccine. But you do need to look at first responders and how to keep them healthy. And we also need to look, Pastor, at what, if any, are the unfortunate potential outcomes of a vaccine, what could be any of the side effects of a vaccine. But we are very optimistic. One thing that many have told us is that you have to, most of the vaccines being tested right now have to be stored at very cold temperatures. And we're trying to make assessment of what type of capabilities we have to store that. Karen Duncan informed me yesterday that we are filling out the proper paperwork to be in line for any of the vaccines that would be available. And my thought would probably be, and some of the things that we're hearing, is that vaccines would first be available to nursing homes and elder care facilities first, and then go to hospitals next. But right now, we haven't gotten anything definitive, but we are looking really closely at CDC so we can come up with our own policies.
And I will add, Reverend Emerson, that there have been preliminary meetings that are actually headed by JPS. Joy Parker has been instrumental in starting the meetings with public health, the outside hospitals, our FQHC, and beginning to develop the operations. So as soon as the vaccine is released, how will we get it out to the community? We're also doing that work internally, so we are being proactive in starting those conversations and setting up for the operations once the CDC releases that vaccine and who it needs to go to.
But we are as prepared as we can be, as we've always had. We are not right now facing any supply issues, no PPE issues. We could always use more nurses. We're having some private talks with Daphne Walker and suggesting that her legal expertise is wonderful for our organization, but we want her to recall her nursing days. And we're seeing if she wants to go to some of the floors and become a nurse again. So she's not smiling at me at all. I just looked at her. But in that regard, we could always use more nurses, and that is a challenge. And definitely fatigue is here. But all my colleagues are facing the same.
Evidently, the judge has. Evidently, the judge has not really attended any of these athletic events, because if you go to the football games, they are poorly attended, but the rules are strictly enforced. They don't let you gather. They check you coming in the gate, because I'm out there every Friday night with my grandson. So I don't know. That's not where the problem is.
Well, obviously your grandson does not play for Notre Dame, and that is a situation. So some are following the rules and some are not, unfortunately. But I think you're right. It is a challenge. It's a challenge all the way around. I think that DT, did you have somebody else had a question? I heard somebody.
I did. So I was just going to say that for those members and also for the community members who were not able to make the quality meeting last week, we got some really great information about the flu vaccine clinics, the drive-through clinics for JPS, and the amount of vaccines that have already been released as well. So there's some good things going on. We just need to make sure community health and also the community outreach is getting there. They've been doing a good job. So thank you.
Thank you. Thank you, Amanda, very much. Our team is working really hard, but we also need community leaders like you and others, because we can only go so far, and we have a lot of credibility and a lot of help when we have the community leaders helping us. So thank you.
Robert,
any other questions you have? Because Mr. Chair, that's all I have.
I heard somebody else.
Yeah, Robert, what about normal flu cases? Are they up, down, normal?
They are. The only numbers that I have on that, Roger, last night, THR reported that their numbers are at about 2% for flu, which is way below what it's been. I couldn't give you our exact numbers, but our numbers are way below for regular flu. We really have not had a flu issue at this point. We're not in the real peak of flu season at this point now, but we're not seeing the numbers. Part of that's because there are probably more people that are staying at home, and there are people that are wearing masks. Some of the same protections on COVID are going to protect you from flu. And so we are seeing the benefits of that. And we are very thankful that we are not having a large flu problem at this point, because then you really do start running into capacity issues. So at this point, flu is not a challenge, but we obviously monitor that and watch that closely.
Is that including the high dosage for the over 65 population, Robert?
Mm-hmm. We do offer that, DT, and we do provide that for our 65 and older population as well.
But the inventory is okay on that?
Yeah. Yes, our inventories are good at this point for that.
All right, thank you.
Thank you. Other questions y'all have? Mr. Chair, that's all I have. Thank you all very much.
Item 7, report from Medical Executive Staff Committee. Cheryl.
Hi, thank you, Mr. Chair, Dr. Weber. I appreciate the opportunity. First, I'd like to echo Mr. Early's statements about gratitude to our veterans. I, too, did not serve in the armed services, but I wouldn't be here without our many men and women who did. And I was born during the Vietnam era, so thank you all to, especially you, Dr. Weber, during that time being in the MASH unit. And congratulations to JPS on their 10th year anniversary of Level 1 trauma. That's really quite a phenomenal feat. And finally, I do want to say this will be my first year that I actually get to toss turkeys instead of receive them. So I'm looking forward to an opportunity to hand those out with some of the other JPS members, so we can make sure we still in some way celebrate with our family, our work family here at JPS. I really don't have anything to present as far as any action items or approval. We're still going through a lot of our policies. Those will be moving forward soon. Just wanted to continue to update. We're continuing our bylaws revision with our legal consultants, and we have made some significant progress. We've worked through a large part of the initial part, and thanks to some information from our MARC survey, we know now where we can also move some things between bylaws and rules and regs. So that work is continuing ongoing. And once we move that through our committee process, then we'll bring it forward with MEC and the actual entirety of the medical staff. So that's ongoing. We're also continuing to look at and work through, and they will be brought forward as well, updating and standardizing all of our privileging cards and information, and trying to make sure we don't burden some disciplines and not others with different things that have been at times controversial nationwide as far as numbers of cases and numbers of care and things of that nature. So lots of digging into those types of things, lots of information being provided and looked at and reviewed and compared to national data, and going through also different national organizations and associations for all the different disciplines. So we've got a lot of work ongoing behind the scenes. And as we finally get through that process, I'll be updating you on that further. And of course, bringing the approval, the policies, and also the new privilege cards to the board for approval as soon as that's completed. And that is my report. Thank you all.
All right. Any questions for Cheryl?
No, Mr. Chairman.
Yes, sir.
Not a question for Cheryl, but just equipment. Is it my laptop, or is there anybody else having problems with the cutting out? Many of the presentations I'm not able to hear. Voices are cutting out, or is it just my service over here?
Yeah, I'm doing fine here.
Yeah, I'm doing fine. Good.
Pastor Emerson, we will send David Mendenhall to your house right now. He is on his way in the speed car. No, I think Pastor, for some reason it may only be yours because no one else is having challenges. So
okay,
we'll try to troubleshoot best we can. I don't know if there's anything David could look at. I think it might be your connection in your house, unfortunately, for whatever reason. It just may be the way things are going.
Okay. Item 8, department update. This is something that we want to do at every other meeting to look at clinical stuff as well. And today is psychiatric with Zelia Ball, and also joining her is Shannon Simmons, Director of Nursing, and Tanisha Kennard, Executive Director of Outpatient.
Mr. Chair, I wanted to let you and the board members know that what we have chosen to do is each month we will bring you rotating a clinical presentation from a department and then a non-clinical team that will give you an idea. Pastor Emerson started these, and our effort is to try to give you all as board members updates on some of the intricacies that happen that you may not be aware of. We have tried to make these very direct and to the point. We have tried to make them so that the people that we have working in these departments love and appreciate their patients and love and appreciate what they do. That's a challenge because they could talk to y'all easily for 6 hours because they do appreciate so much where they are and what they do. But we have tried to sort of get it to a point where we're just telling you some of the things you may not know. And what we're going to feature today, as you mentioned, is Zelia and her team. Shannon Sims and Tanisha Kennard they're just 3 people that are very representative of our psychiatric and behavioral health teams. Those people are phenomenal folks. As you all know, they're trying to help people who in some cases, sadly enough, may be destructive to themselves. They may not understand the realities around them. They may be hearing voices or seeing visions that us in other capacities are not witnessing. And so when we celebrate 10 years of trauma care, which is, as you know, Dr. Weber, decisions made by the second, we are also on the other end of that spectrum trying to keep a patient as our partner for the next 30 or 40 years. And all we're trying to do is show that patient warmth and care and understanding in a very, very difficult world. COVID has been a challenge because it has restricted many people not to be as mobile. It has created a level of anxiety and fear in people that don't want the world to be any different than what they're trying to cope with. So to Zelia and her team, and particularly the two representatives in Shannon and Tanisha that you're going to see today, they're really phenomenal folks. And we wanted to just focus on one small item of what they do. So Zelia, if you would introduce your team and sort of y'all's efforts.
Thank you, Robert. Thank you, members of the board, for allowing us to present today. You know, as executives, we really are truly only as good as our teams and the leaders that we work with. And we at JPS are very fortunate to have two leaders that will be presenting to you today. Shannon Sims is our Executive Director of Nursing, and Tanisha Kennard is our Executive Director of Outpatient Services. And in my humble opinion, these two ladies rock, and they do an amazing job. And so without wasting any more of your time, I'm going to let Shannon Sims share her journey with you.
Yes, thank you, Zelia. As she mentioned, my name is Shannon Sims. I would also like to thank Mr. Early and the board for giving us this opportunity to come and share a story with you today. I'm excited to get to brag on our team and all their efforts and hard work during the pandemic. You know, back in March, when all of this was really beginning to take shape, our leadership team and providers came together to begin planning. It was extremely important to us to continue to provide care to our behavioral health patients. We knew that the pandemic would only increase their anxiety and could potentially trigger worsening depression due to isolation or possible loss of employment even. We also recognized that our staff were scared. We as leaders were scared. So there was a lot of fear and unknown that we were dealing with going on. So we formed a task force, a command center, and we began planning. I'm really hoping that a lot of these plans wouldn't come to pass. Unfortunately, that just wasn't the case. So this is just a real high-level overview of some of the things that we implemented during this time. Visitation, as Mr. Early mentioned earlier, it's very important for our patients to have a strong support system available, is crucial to their recovery.
Sean, can you change the slide, please? Thank you.
Okay, there we go. All right. Unlike on the medical floors, where family and loved ones are able to come up and visit with the patients in the rooms, we hold visitation typically in a common space or common area. So we had to change all that, which now led us to our current practice today, which is virtual visitation, and we're really happy to offer that for our patients. On our units, in a behavioral health unit, it's a communicable type setting with a day room where groups are held and patients are able to watch TV. We created ways to keep our patients safe while utilizing these common areas. We also implemented telecourt, providing court through a virtual platform so that we would not hinder the patient's course of treatment or possible need for commitment. We also provide tele-attorney visits so that the patients are able to meet with their attorneys before these proceedings. So those are some of the things that we implemented on the units. On April 29th, we had our first patient test positive for COVID-19. We had a small outbreak within our department. We opened the behavioral health COVID unit on May the 1st. We know that it was the first in our area and possibly first even in the country. I think it's really important to note that all the staff who worked this unit volunteered to do so when we were planning. That was one of our fears. How are we going to staff it? We didn't have to ask. They offered. We closed that unit, I believe, in late June, so it was open from May 1st to late June. And one of the things that I mentioned earlier as I began this talk, we recognized early on the struggles that our employees were having So we formed an employee concern committee where we had 6 of our leaders round on both shifts and brought all concerns, needs, and questions to the leadership team. At that time, we would meet every afternoon. And then we would take those concerns and address them the best that we could in real time and push that information out. And I really believe that that was critical in keeping our staff as well informed as possible and easing some of that fear and anxiety. So this is just a high-level overview. I think right here, and this, I love to take pictures. I love to preserve the moment. You can see our command center and the kind of that bottom right-hand corner, and then the staff that you see here are the staff that volunteered to work our COVID unit. Makes me a little misty-eyed sometimes. So I will now turn it over to Tanisha to discuss some of our outpatient initiatives.
Hello. Thank you for allowing us to come and kind of share our heart with the board. Thank you, Mr. Early and board members. If we can go to the next slide, please. What I really want to share with you is to give you some perspective of what was going on in our outpatient services as COVID kind of struck. What you see are 2 data sets in front of you, but what's important is the story behind the data. We, of course, are serving a population of patients that tend to be more vulnerable. They're already dealing with depression. They're already dealing with anxiety. And on an outpatient basis, we have the full continuum of patients. We have those just getting out of the hospital, as well as those that are just receiving routine care in our clinics. And so what you see before you are the metrics on one side from our call center. And what I would like to share with you, behavioral health operates its own call center, and we have an 8-person team, and they are a mighty team. But during COVID, our call volume increased from the previous year by about 30,000 calls. And that gives you some indication to what the need was looking like in the community. But it was also because of our pre-work to try to prepare our patients who really benefit from routine to the constant change that we anticipated and knew we were about to go through as a system. So about 20,000 plus of those calls really were outgoing calls where we had team members on the phone preparing our patients for what their clinic homes were going to look like if they came into clinic, getting them prepared and ready to get on a telehealth visit set up on MyChart or the various platforms, be it telephone or MyChart, to be able to have their visit and really talking them through any of the anxieties or fears that they may have. And in a lot of those cases from those patients, what we were hearing was how much JPS behavioral health is part of their recovery journey and how important it is that they see the same people and kind of experience the same things when they come into clinic. And so a lot of that work was on the phone with those patients, kind of quelling those fears, giving them resources and making sure that they had access to what they need. At the same time, our call center, which is typically a scheduling line, was receiving calls from people who were experiencing depression and anxiety for the first time and had never experienced it before, but because of the stresses that came along with COVID and some of the isolation during the shutdown and just the constant change and the loss of work and even the loss of family members in some cases, they were experiencing symptoms that they had not had before. A lot of the pre-work and the work that the call center and our team who joined the call center to operate and work on those calls were able to do resulted in our volume numbers at the end of FY20, where we surpassed our FY19 volumes by over 4,000 visits. People were in need, and those needs showed. Our no-show rates went down as low in some cases as 17%. Which is significantly low for new patients to behavioral health. That first appointment to get a person to come in and talk about what's going on with their mental health is typically the hardest one to attend. But what we saw in this season is that people were not only showing up, but they were showing up ready to engage in that conversation. What we've seen since then from the community has really been kind of a shift. And while COVID has been stressful and definitely has been negative for in most areas of our lives, this shift in the conversation in the community has been a positive one. Because I believe so many new people are dealing with behavioral health needs in a way that they haven't before, people are open to having this conversation. We're seeing an increase in need and an increase in willingness to seek out and actually access the available services. So in terms of needs in the community, what we're seeing is increases in depression, of course, as people deal with isolation, loss of work, sometimes loss of housing and resources. we're also seeing an increase in anxiety and worry related to some of those same things. And then there's the element of grief that is related to the loss of things, property, routine, but also the loss of family members. And so we have really been working to equip our teams and to be able to engage in those conversations. We're receiving positive feedback from the community. Telehealth has been a huge gain for behavioral health, and we've had feedback from patients even that had it not been for those telehealth options, they may not have kept their appointment. So we've seen increase in utilization and an increase in patient satisfaction overall with what they're able to access and how quickly and convenient that has been for them. So I would like to open the floor if there are any questions that you may have for Shannon, myself, or Zelia. We'd be glad to answer those at this time.
I've got a question. Tanisha, the improvement, the 17% rate that lowered, is that due to telehealth, or were those just in-person visits?
So we saw an improvement in in-person visit. The in-person visit rate improved by about between 5 and 10%, depending on a month, averaging at about 5%. But our telehealth video no-show rate, that one never passed 17%. And so telehealth definitely had an impact on improving our show rates to appointments.
Was telehealth available prior to COVID?
No, sir.
Okay.
This week, we stood up telehealth in 1 week in our outpatient clinics and our inpatient programs. And so it long overdue and quick to happen, quick to implement, but the outcomes have been very positive in behavioral health.
Well, those outcomes are certainly a wonderful testimony. Thank you.
Thank you.
Any other comments? I'd like to just make one. I'd say good job, folks. I mean, you got to be real proud of what you folks are doing over there. I'm impressed. Thank you very much.
Mr. Chair and board members, I would also indicate that to Zelia, and she will not necessarily take credit for this, but to Shannon and to Tanisha and the numerous employees that we have in behavioral health, it takes a toll on you trying to help that population, because it takes in part of your heart and it takes in part of your skill set. And they are amazing people, and it takes a special group of folks to deal with the hardships of trying to deal with people, to make them partners with you. And I can't thank the team enough. And it's not what any of us encounter on a daily basis, but that team does. And if you ever tour the facility or meet the people who are reaching out in need, you know how strong the JPS behavioral health team is. And I would match them against any institution in the United States, and we would win every time. They're wonderful.
Thank you, Mr. Early. One quick note. I would be remiss if I did not share with the board the wonderful partnership we have with our providers in pulling off every bit of this. They were with us in the war room. They were with us on telehealth. They were with us when we were all freaking out, because we did, in full transparency, it was all new to us. And our doctors were right there with us, and our mid-level providers. And, you know, it truly, you know, a crisis can either bring people together or tear you apart, and it brought us together. And that's really how I feel like it's been for JPS across the health system. But in particular with our providers here, it just made it everything better than what it could have been. So thank you all for letting us share. Mr. Early and Dr. Duncan, thank you for helping us and giving us the tools that we need to be successful.
All righty. Any other comments for Zelia, Shannon, or Tanisha? Thank you. Next thing is item 9 is committee reports and action. First is Joint Board Finance Planning Committee, and that would be Steve or Trent, either one.
Go ahead, Steve.
Sorry, I couldn't get my mute off. we had a joint finance and planning meeting on October 22nd. I think most everyone was there. I think Dr. Simmons wasn't able to attend, but I think almost everybody else was there. We reviewed the September financials, which took us to the end of the fiscal year. We also passed forward a whole mess of agreements and contracts for your consideration. They're on the consent agenda. Sharon is here to give you a financial summary if you have it, if you have any questions. Otherwise, I think that concludes my report, Mr. Chairman.
Okay. Comments, questions for Steve? Okay, Trent? You have anything for planning? I can't.
Trent, you're muted. Unmute you.
Yeah.
There you go. I don't know. Trent, can you hear us? If you can hear us, take that little button. Yeah, you can. It still shows that you're muted. And
there you go. No, my panel on my screen had shifted below the bottom and I couldn't see the mute button.
Well, the other thing is I think Steve Montgomery kept muting you.
No problem.
I think that was it.
Him or Charlie. No. We're fine. The meat of the planning meeting really was, as most of you know, about update on facility conditions, and the board was good enough to give staff the thumbs up to move forward with some specific recommendations relative to facility repairs and maintenance, and those are forthcoming. I've seen some preliminary information already on that, so staff is working diligently and quickly. The other element was an executive session discussion, which again, most of you were there, so I don't have anything beyond that, Mr. Chairman.
Comments, questions for Trent? Seeing none, okay. Governance, Roger Fisher.
Thank you, Mr. Chairman. I just first want to say that I thoroughly enjoyed the planning meeting, and even though we've got a looming bond issue and hopefully lots of new shiny buildings coming up soon, we still need to show a little bit of love to the older facilities that we have, and that planning meeting really opened our eyes to some pretty emergent needs, and I appreciate Trent bringing that up to our attention. Governance, we held on the 22nd of October. As always, it's a superb meeting, and honestly, I say that in jest, it was a good meeting, and they keep getting better. The governance team, Ron and Michelle and Tim, really are bringing us very good, worthwhile information. There are some policies for approval that are on consent agenda, LD 2900 and 4200, pretty nondescript and just kind of change of verbiage issues on those things. I do want to make a note and ask Robert your help. We're having some difficulty getting audit client survey results. I take that as a positive, meaning somebody doesn't have anything bad to say on an anonymous survey. Generally means the team is doing something pretty good, but the return rate on those surveys is pretty low. We need to figure out a way to entice, threaten, I don't know what the right word is, that we get some of those results better so that that internal audit team can continue to get better and with their interactions among their peers and among the various departments. Typically we'll get them bad if there's something bad or somebody has to say something, and you don't get them back when they're good, but that positive reassurance doesn't hurt either. And I don't know the best way to go about that, but that's all we have for governance.
Roger, I appreciate your comments, and we'll focus on the entice part rather than the punitive part, but we can definitely do that, and we will work on that. Thank you, though.
All right. Thanks.
Are those supposed to be coming from the board, Roger?
No, they come from the internal audit too, through a private, SurveyMonkey anonymous survey. But there's really not, there's a carrot, but no stick, or there's a stick and no carrot. Either way you want to look at it. And so all those surveys do is help the team get better in their questioning and going through their internal audit process.
Are we as board members supposed to be sending in those surveys?
No,
sir.
those are going to the people that are targeted by the whatever audit comes up.
Okay.
So it's a random sample of those people that had a role in either preparing for the audit, performing the audit, for the subject area of the audit.
Alrighty. Comments, questions for Roger? Trent, you're up again with the planning committee of November 5. Anything for that one? No, you're still muted.
I'll help Mr. Petty while he mutes or unmutes, but that's pretty much the.
No, we're good.
There you go.
There he is.
Yeah.
We're good. I covered
Yeah,
all
same
my
thing.
previous comments.
Yeah, previous thing applies to the November 5th.
Okay, the last one on is the quality committee, and we met on the 5th of November, 2020. There are 7 policies on the consent agenda. Second thing we entertained was a very extensive quality scorecard update on our PSI 90 scores. The third thing, and I would encourage anybody that was not listening in on at the meeting, go to YouTube and check this out. But it's on COVID management beyond the walls, which is a program done by Peter Smith, set up by Michael and Diana and 3 people I'd like to mention: Afnia Brown, Devin Armstrong, and Dr. Nadia Alawi. Because what they've done is unbelievable in taking care of COVID positive patients in the community that otherwise would be tying up beds in the hospital. And one of the things that got me was how they went to the distributors of oxygen and had them come to the table with our folks so that we could treat these patients as outpatients. It was awesome. And then the last thing was presented from the Innovation Corner was a summary of the Level 1 trauma system from its 10th anniversary. And that's it for the Quality Committee. If anybody has any questions or comments. Seeing none. Okay, next one is matters requiring board discussion, approval, deliberations. The first one is A, reappointment of J.R. Labby to the TERS number 3, City of Euless.
Mr. Chair,
I'd like to entertain a motion.
Yeah, Mr. Chair, this is just typical of what we do, and we've decided collectively to have one member represent all of those tax increment zones and TERS throughout Tarrant County. It creates consistency, and it's quite helpful. So we have selected J.R. Labby to do that. She serves on all the others, and that's what that's about.
Mr. Chairman, I'd make a recommendation for approval.
Is there a second?
Second.
Any discussion? All in favor, please say aye.
Aye.
Those opposed say no. Okay, B is consider approval of appointment of J.R. Labby for the TIF City of Benbrook.
Mr. Chairman, I make a motion for approval. She can get from Euless to Benbrook pretty quick.
Second.
All right, motion and a second. Any discussion? All in favor,
This
please
is called
say
being
aye.
voluntold.
That's right.
That's right. Good.
Who is it? Who is that?
That was Roger. I said this is what you call being voluntold.
Oh, okay. Motion and a second. Any discussion? All in favor, please say aye.
Aye.
Those opposed say no.
Congratulations, JR.
Yeah, big time.
Next one I have is FY21 contract between Tarrant County Hospital District, JPS Health, Mental Health, Mental Retardation. Zelia.
Thank you, Dr. Weber. Good afternoon again, board members.
Is it C or D?
I am pleased to present this contract.
Mr. Chairman. I'm sorry to interrupt you. Yeah. this is a very important contract, but there are some items to it that I still have some questions about, and I'm going to respectfully request of my colleagues that we pull this one and take a look at it. There's been some questions about the KPIs in it, and wanted to get some clarification and maybe give us a little more time to work on it. So I was going to ask if we could pull this from the agenda and bring it up in December instead.
Is that in the form of a motion, Steve?
Yes, sir.
Mr. Montgomery, I think also that you will see that C and D are pretty complementary. I think one's the issue, and Zia, you can correct me if I'm wrong. I'm not trying to tell you your motions or your contracts here, but I think the issue would be for C and D as well, because D is the funding measure, so they are connected. Is that correct, Ms. Ball?
Well, no. So C and D are really two separate contracts. C is regarding county services that we pay MHMR to provide to the citizens of Tarrant County, like substance abuse treatment, peer support, and crisis services. Whereas D is contract for providing mental health services in the jail and in the public health contract.
Okay.
So it's up to you, Mr. Early.
Okay, so I'm trying to make sure Mr. Montgomery then his motion would be regarding item D, because that's the actual funding measure.
That's the one that, right. Okay. Sorry about that. I had those reversed.
That's okay. So we're gonna pull back letter D.
That would be my request.
Let's deal with C first, since that's the one.
Okay.
You want to withdraw your motion to approve C?
Yes, sir. I'll withdraw my motion on C, and I'll bring it back up on D. Thank you.
Okay. Do you want to make the motion to approve C?
I do. Yes.
Okay. Is there a second? I'll hear one.
This is Dorothy. I'll second that.
Yeah.
Discussion on. All in favor, please say aye.
Aye.
Opposed, say no. Okay, D, Steve.
Unknown caller.
Thank you, Mr. Chairman. This is the one I'd ask us to consider deferring for another month so we can work on some of the KPIs in it.
Steve, this is Charlie. Can I ask one question?
Yes, sir.
And I don't disagree with you at all. Only question I would have, since this is the funding mechanism, with our delay, we wouldn't be eliminating any services during this time period of a month, would we?
That was a question I'd ask, and we would not.
Okay, that's the only question I would have. So, thank you for that answer.
Good question, though.
All righty. We've had a motion by Steve. Is there a second?
Yes, Chuck, I'll second. It's Charlie.
Second by Charlie. Discussion. All in favor, please say aye.
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 Opposed, say no.
Aye.
Okay, E. Purchasing procedure. There's Douglas Chung down there. I see him.
Doug is here, and Doug, if you want to go ahead and outline this contract, that'd be great.
Yes, sir. Thank you very much. So this is consider the approval of one exception to bid, and two, an approval for us to purchase reagent through a master agreement between Abbott and Tarrant County Hospital District. It's for $106,000 and $622 annually. So again, this is allowing us to purchase COVID-19 ID Now testing reagent, which will allow us to do additional point of care testing at the facility. The contract will automatically terminate with either the end of the emergency use authorization that Abbott is under right now for the ID Now reagent, or no longer than a 1-year period. And to clarify, just because I know this did not go through the normal financial procedure in committee, and it's going directly to you as board members to approve today. We are asking for approval on the contract once it is finalized, not to exceed the approved spend and term on the given contract. We're still outstanding 3 legal items at this time. And to further explain why this has not kind of followed the normal timeline, Abbott has given us a deadline on this agreement to become a purchasing entity by November 15th. And they have given that same timeline and same deadline to all hospital entities. So you can imagine the amount of contracts that they are trying to process at this time has backed up their system and contracting, and hence some of the reason on the delay for this one.
I want to tell you, board members, that this one is essential, but it's been challenging because this puts us in line for the testing and the stability of those COVID tests that we need. However, and Doug, correct me if I'm wrong, I think in Abbott Labs queue, there are 1,200 contracts nationwide. And we have been working diligently to get the information from their legal team. We even threatened to send Suzanne directly to their headquarters, but that scared them, but they still couldn't get the information to us. But we did not want to miss the opportunity to bring the contracts before you at this board meeting, because it really would have put us in difficulty in securing testing for our COVID patients. So I apologize the fact that you didn't have full information, but these contracts came up not only quickly, but they came up because of the stress that the nation as a total is in trying to get the security of testing products. So our 2 platforms are Cepheid and Abbott Now, and these secure us, even though we didn't get all the paperwork from Abbott. It's a continuation of what we've been doing. It just secures it for the future. And Doug, I appreciate, Doug is brand new and Doug was working on this, and it really was a challenge, but we didn't want to miss an opportunity and put our COVID testing at risk.
All righty. Somebody like to make a motion to approve and then a second.
Mr. Chairman, this is Steve. I move approval.
See, other Steve, I'll second. Don't we also need a motion for the exception to bid, I think, don't we?
That's correct.
So I amend my motion to include the exception to bid.
I'll amend my second to second Steve's motion.
All right, discussion. All in favor, please say aye.
Aye.
Those opposed say no. Not hearing. The motion passes. F, similar.
Similar, Mr. Chairman, so thank you. This consideration is for 1, an exception to bid, and 2, the approval of the Cepheid 4-plex test agreement between Cepheid and Tarrant County Hospital District. This agreement, if approved today, will give us the ability to purchase this 4-plex test, which tests for COVID, flu A, flu B, and RSV at the exact same time. As you can imagine, going into the respiratory season here, clinicians will want to have the ability to differentiate between those four diseases on the same patient, so then they can appropriately treat the patients with the most effective therapies. This test does that for them. And in addition, some of the, again, this did not go through finance in full transparency, and some of the delay on this one and this purchasing agreement, we were given a very late deadline from Cepheid to execute this purchasing agreement, and a commitment for a 90% spend of our FY20 allotment, which would save the district approximately $489,000 on an annual basis if we were to move forward with this agreement. This agreement as well can terminate at any time. So again, apologize for this not being in the proper fashion, but similar to the comments Mr. Earl had before, we felt necessary to take advantage of the price savings on this one, as well to be able to provide that more complex test to our clinicians who are doing this work every day on the front lines.
Douglas, thank you. Any discussion? Any questions for Doug? If not, I'd entertain a motion for the exception and a motion for the approval and a second.
Move for approval for both.
Second for both.
No discussion. All in favor, please say aye.
Aye.
Those opposed say no. Motion passes. Item 11 is the consent agenda. Was all sent out ahead of time. And if it's okay with folks, I'd entertain a motion for approval and a second.
Mr. Chairman, I move for approval.
Second, Dorothy.
Charlie.
Discussion for anybody? Seeing none. Those approved, please say aye.
Aye.
Those opposed say no. Consent agenda passes. Next thing I have is item 12, which is report of legal counsel and or legal matters requiring discussion, report of contracts negotiated on behalf of the Tarrant County Hospital District.
Thank you, Mr. Chair. Before I give the number of contracts, I was going to take advantage of the time to just give a brief report to the board as I round out week 7 of my tenure here. I'm getting to be old hat at this. Mr. Chair, you've already mentioned that going forward, I will have a quarterly meeting with the officers, and I think that that will inform a lot of what I present to the board during this report. But I am excited just about the opportunities as we continue to add value with an in-house legal team. You know, having an in-house legal team allows us to have close collaboration with our business and clinical leaders and to be able to provide some practical guidance that's just right size for the organization. So when you made the decision to transition those services in-house, you were increasing the opportunity to really get the type of legal advice that you want, and we can, you know, definitely give some prospective guidance going forward. You know, part of my primary focus, of course, is building out the team, and we do have some semblance of a team today. I have an executive assistant who's also a paralegal that supports me. We do have human resources counsel support. We have a contracts team who I know you're familiar with, and we have a legal claims manager who manages that function for us. We also have a contract with the district attorney's office to handle certain services for us. But we've already begun contemplating what our future team members look like and have already posted for senior counsel of hospital operations and a senior paralegal to help support the department. And I'm beginning to start that full staffing analysis to really assess the needs of the district based on the current legal matters that we have. Some of the other things that you'll begin to see, because when you have an engaged legal counsel in-house, we can kind of better manage engagements of outside counsel because we will be more astutely aware of some of the precise legal questions that come up for the matters that the district is working on, and that allows us to better also manage outside legal costs. And I already mentioned the prospective guidance, and then you just get the just-in-time support of the day-to-day operations. We can be more closely involved in strategy and respond to governmental agencies. So we're continuing with the transition, and this is really just a high-level update, and we expect to do more of this in the future. We'll, as we do that, the leaders will begin to experience more direct interactions from the internal resources, and we will continue to focus on in-depth policy review, contract process review, as we begin to just improve how we support the district directly. And with that, if you don't have any questions about kind of the current state of things and what I'm working on today, I will go ahead with the report of contracts. We had 40 contracts.
Debbie,
I'm sorry, go ahead.
I've got a request, if it's okay with the board.
Sure.
Whenever you get that idea of what your overall organization looks like, could you provide us with an org chart?
Oh, sure. The staffing analysis will definitely come here.
You know, this is, I've been around for the first time, and this is the first time I've heard what we have counsel for HR. And so I just want to see how the intricate web that is legal services is woven, and how it works with you and your new part of the organization.
Absolutely.
Thank you.
Yeah, that was on my list for the executive session, but that's good, Roger. Thank you. Any questions, comments for Daphne? If not, the next item is reconvene.
Whoa.
Let me.
She didn't finish.
Let me give the report on contracts under 500,000 for the month of October, and we had 40.
Forgive me.
I'm glad that to see that somebody has my back there.
Okay, fire away.
We had 40 contracts under 500,000 for the month of October, and that would conclude my report, Mr. Chair.
All right, questions for Daphne? All righty. Next is reconvene in executive session pursuant to Chapter 551 Texas Government Code for the following, and there's a whole list of stuff. So we'll be going out of open session at 2:21 or 14:21 hours, and how about if we come back in 5 minutes?
All right.
right, thank you. I'd like to reconvene in open session for deliberation action necessary regarding any matter listed on the closed session agenda, and that would be privileges. Cheryl.
Cheryl, unmute yourself, because if you don't unmute yourself, we're going to have to call you Ron Skillins.
I apologize. I thought I hit the button to unmute and I didn't hit it hard enough. So thank you, Dr. Weber and Mr. Early. I will make a motion to approve the privileges as presented in executive session.
I would second.
All right, there's a motion and a second. Any discussion? All in favor, please say aye.
Aye.
Those opposed say no. Motion passes. That's all I have, and then I'd ask for a motion to adjourn.
Motion to adjourn.
Second.
All right, we're adjourned at 15:17 hours.
All right.
That's,